Hi, I'm Carol Rose Atkinson, president of ificandoityoucandoit, and I'm here with Judy McGee and Sherry Shockey Pope. Never say that quite right. From Central Counseling, and they're going to be speaking on suicide risk assessment and interventions, which is a relevant topic, especially more so now than ever. 6-hour course, speaking on September 25th. From 9 a.m. until what,
3:30.
3:30. Okay, so we get a break for lunch, guys. That's great. I just would love the ladies to introduce themselves. So Judy, I'll let you go first.
Hi, I'm Judy McGee, and I've been in this field for several years. And I closed my practice in San Dimas last year, and I am here at Central Counseling with Sherry and Jill, and I'm very happy doing the work here.
Well, it's nice to meet you, Judy. You look so familiar to me. I don't know how I know you, but I've seen you around somewhere.
Yes, I've been around a long time.
Yeah, so I guess I kind of have been too, or at least on the earth. Sherry, can you introduce yourself?
Sure. My name is Sherry Shockey Pope, and I have been in the field also a few years. And I am co-owner of Central Counseling Services, and I actually met Judy through IE Camp. So it's kind of a strange world how things are connected like that. And we were able to lure Judy away and have her come work with us, which has been great. So that's where we are.
Awesome. Okay, so I'm not sure how you want to do this, but I know you're going to be speaking on suicide risk assessment. Sherry, what subject matter did you want to make sure people come away with?
We wanted them to make sure that they knew what to do without feeling anxious, without, like, when people come in their office and they decide that they want to end their life, our anxiety as therapists go up, and we start running through our head. What am I supposed to do next? What's the next thing to do? What am I supposed to ask? What form should I use? And we didn't want that to happen. And then when they had the legislation change that everyone's going to have to be have a new suicide class, and it's been such a long time since I was in graduate school, I wasn't going to, how am I going to figure out what I took? And there's been things that have changed since then. And so I asked Judy if she would mind co-teaching with me, and she jumped on board, and we created a curriculum. But we want really therapists to feel confident that they know what to do and that they're not scrambling at the last minute, because there's nothing worse than our clients are having anxiety and then we're having anxiety too.
Which is shocking. Like, therapists would have anxiety. That's just like, because aren't we supposed to be perfect? Judy, one question that was crossing my mind as I was talking to Sherry was, not just therapists will be watching this video. I have pretty good audience within my Facebook, and then we've got within IE Camp, and then within the groups. Sometimes people see this that are not therapists. Can you speak to somebody that is feeling suicidal?
Wow. Okay. Well, I was at Aurora Charter Oak for many years, and at the time I was there, I was the only 5150 therapist in the building. And so I learned very fast how to work with people who came in for IOP group during the day, suicidal, didn't want to live anymore, couldn't figure out a way to make it through. And so I developed a little bit of a program at Aurora Charter Oak with the director of Aurora Charter Oak. And it was my job, even if I was doing a group and one of the psychiatrists pulled me out, I needed to sit with the patient and talk him or her through that process and how we could keep them alive. And that was a very daunting task because we had a variety of clients at Aurora Charter Oak at that time. I really like doing the narrative piece. I like talking to therapists about my own personal experience with suicidal clients, some in my private practice, some at the school when I was doing a school program with interns. And I like telling people the experience that I went through. So I have two different pieces in our training where I'm going to be talking to that exclusively.
Got that. Thank you so much. Another thought that crossed my mind as a clinician, um, people do have suicidal thoughts, you know, what we call ideations or thoughts, but not necessarily plan and means. You know, maybe they are in pain, whether emotional or physical. And Sherry, um, I normalize that with clients and help them to understand that having a fleeting thought or even a longer thought doesn't scare me as much as the plan of means is like, you know, 5150 kind of thing. How do you feel about that?
I agree, Carol. I think that clients come in and they want to talk about really intense emotions and they want us to help them talk it through. They're not necessarily looking to completely end their life, but when some therapists hear the word ideations or suicide and they expand on it, then it's sort of an automatic, I'm calling the police. And our clients don't want that. What they want is to talk about it. They want to, you know, say, explore, you know, how can they have these feelings? How can they minimize the feelings? How can they live through the feelings without us freaking out? And unfortunately, research shows that when a client comes to a therapist and tells them that they're suicidal, that therapist sort of packs them up and sends them to somebody else. And sometimes clients will go to 3 or 4 therapists before they can actually really address the suicide. And we don't want that to happen. We want people to be able to feel confident and move through that process with their clients.
Absolutely.
Yeah. And Judy, another thought that crosses my mind is so many people will come to me and go, oh, my child's a cutter, or my, you know, my friend's a cutter, and thus they're suicidal. I don't personally believe that. What do you believe?
I don't believe that either. I think cutting is very different than having suicidal ideation. And unfortunately, cutting has become very popular in junior high and high school with kids. And so we have that a lot in the school program. I have very little of that in my practice here, although people are entertaining a way to feel, and that's through cutting in many instances. You know, when we were talking about doing this program, we looked at each other and said, how can we make this light? And so we didn't really make it very light. It's hard to make, you know, suicide ideation and the process we might go through. We don't have jokes to tell, but we have some wonderful videos and some wonderful information. And we hope that they will be engaged with us so that they won't panic. I've had many, many interns over the years, and a lot of interns panic when we're doing supervision. So-and-so said they were going to do this. I don't know what to do. I just fell apart in the room. We don't want that to happen with our licensed people or pre-licensed. And so we want to give them the information they're going to need to be able to feel contained themselves so that they can help listen and contain their clients and not be freaked out. That's our aim.
Right. I've been to a number of suicide trainings, and they talk about the patterns and the history and like the point system of, you know, do you meet this, do you meet that criteria? But to me, every person is unique. And then some different disorders that we do talk about it a lot, but, you know, they don't always necessarily follow through. In fact, quite often don't. I personally have a history of that, and I'm here and alive and well. You know, I can't say I did have debilitating depression that doesn't exist anymore. So with that said, it's like, you know, the hope is there. The hope is there for our clients. The hope is there for our therapists to be able to help them progress. What do you ladies think?
I agree. I think that we can help people in this training to understand the ins and outs of what to do, how to go about doing it, having a script if they need that. Some people need a little bit of a script to help guide them. Sherry, what are your thoughts?
I really think that suicide's preventable, and I think that's one of the reasons why the legislation has come down, that they want it to re-educate everybody on it. I think, again, sometimes, I don't know, maybe you've seen this too, Carol, is that we get a client that comes in and sort of everything's okay, and then the next thing is, I'm suicidal.
Mm-hmm.
And there's like no cogs in between, right?
Mm-hmm.
And so part of it is us adjusting as therapists to help them develop those cogs, but also to educate them that just because they're having a bad day doesn't mean tomorrow is going to be a bad day. And feelings come and feelings go, and we have to learn to tolerate the how they feel with us, how they resonate. And I think that that's what this class focuses on. I think it also it's very hands-on. We put a lot of handouts in this class. So people will leave this class with actual tools that they could use the very next minute they see a client.
That's awesome. That's going to be very useful for all therapists, but also if anybody wants to learn about this. This new law that they have, I myself need to look it up. So I can't wait for the class. So I'm always interested in learning. I think I have about that many, I think, CEUs. The folders are getting bigger and bigger. But whatever it is, that we can never have enough tools in our tool chest. And in this case, right now, very relevant, very important. So glad you're teaching this. We'll be meeting on September 25th, and please sign up. We will have the information for central counseling. How many locations? You have 3? Two
in a school.
Two in a school. So that is Riverside and...
We're in Riverside and Marietta.
Okay, that's what I thought, but I just wasn't sure. Riverside, Marietta, although I say right now California is a royal house, so it doesn't really matter. Unless it's a suicidal client, then we have to consider whether that is ethical to have that client as a telehealth. So that alone could be its own discussion. And are you going to discuss that, by the way?
Yes, we are.
Yes. Okay, good. That is so important because most of my staff, and I will probably have, and I think I have 20 on staff right now. I'm going to ask all my staff to find a way to be a part of this because it's so important that they have these relevant takeaways, and they certainly want their hours, so they'll get that. But also speaking to the person who is feeling suicidal, please get help. Please get help. Call 911 or go to the nearest emergency room, whatever you need to do. Get a therapist. You need those resources. I mean, I think to me that, that connection is so more important than going into a hospital, being medicated and coming out. So yes, medication may be a part of the treatment, but if you don't have that connection with those resources of humans that you can talk to, that you can say all those secrets in your head that you think you're wrong, bad, or broken for, that's where, to me, that's where people get stuck up. What do you think?
Yeah, I would agree. I think building the relationship with the therapist helps. And I think it actually, I think the research shows that the connection with the therapist is a very good predictor of suicidality.
Yeah. I mean, I know that to be true. I one time called 911 on one of my clients, and the police saw the, connection with the client and went, we're not taking this person, but I had to do my due diligence at the moment. But that person is still doing good, actually doing great. So with that said, I look forward to the meeting on the 25th, and that is in 2 weeks. I believe.
Yeah, 2 weeks, 2 Fridays.
I'll be honest, I've lost a little bit of time on these after effects of COVID, but I will be there. Thank you, ladies, so much for this, information. And we will post everything. I'm sure we've got some friends that will help with that. Please share this to as many groups as possible. Let the therapist know, even let your clients know that, it's just a short tidbit to give them the hope that they need. So is there anything in further that you would like to say, Judy?
I'll just say that I have two pieces that I'm going to share, which is more of a relational piece. One of a suicide of a client of mine many years ago. And then I'm going to talk a little bit about suicide by engineer, by train. What we don't hear often, suicide by cop is knowledgeable for many people, but we're going to talk about the engineers and the conductors on Amtrak.
Oh, interesting. I'll talk to you sometime about that. And you, Sherry, is there anything you'd like to say?
No, I just think that this is really relevant, and we do have a big chunk in here about COVID-19 because that's changed the way a lot of us have adapted.
Mm-hmm.
I know not that you've been suicidal for COVID-19, but you had COVID-19 to know about it, and
Oh,
really
yeah.
have yeah. So that's really a good knowledge base, and so it's helpful for us to be able to figure out what our clients are experiencing. So we're going to talk a little bit about COVID-19 and suicide as well.
That's great because it does affect the brain. I mean, Dr. Amon's done work on that as well as other people. And that is important to know. There's a cognitive, like a brain effect from COVID-19 that we're only just beginning to understand. Of course, we're only just beginning to understand COVID-19. But that's another subject. But thank you so much for saying that because that is so relevant. Also, mental health in general has gone up so high. People that have been stabilized are now resurging in their disorders, and all because of this COVID-19 world. So it's very, very important. So with that said, thank you, ladies, so much for talking to me and talking to the audience. And we look forward to the training. And thank you for all the good work you do. They both are in central counseling. So if you need, how many do you have on staff now, Sherry?
We have 27 therapists.
27 therapists. You got me beat. And I'm like, I can't even work right now. I have somebody else running my company, but you got to do what you got to do. So 27 therapists there. And so that means 27 therapists that can help statewide in terms of their licensure. And, if they're coaches, then they can help worldwide. It just depends on what they are. But with that said, we look forward to it. And thank you so much for putting this together. This is so needed with new laws constantly. I can't keep up with the laws changing, constantly changing in every venue. It's like, it's so important for us to keep up our training and never stop with that. So with that said, have an awesome day. I don't think it's the heat wave out here anymore, thank God. It depends on where you're at. With that said, have a great day, and we will see you on September 25th, 9 to 3:30.
Yes.
Thanks,
Be
Sarah.
well.
Bring your coffee. All right. Thank you.
Bye-bye.